For years, HIPAA let you document why you skipped a safeguard. That option is going away, and here's what practices need to know.
There's a proposed rule from the federal government basically rewriting what HIPAA is going to require for technical safeguards. It hasn't been published by the Federal Registry yet, but the direction is pretty clear. They've gone through final comment period. The biggest shift is that the safeguards that used to be considered addressable, meaning you could document a justification for why they weren't implemented, are now going to required status, where everyone is required to implement them regardless of practice size, finances, capabilities, technical know-how. It's leaving very little room for the "we chose not to do it, and here's why" side of things.
For a practice that's been operating on that older, more flexible standard, what does that mean in practice?
It means that there's going to be a real review coming, that things that were considered best practice but were not mandatory before now have to be provable and auditable that you are implementing them. There is no "we thought about it" or "we're planning it" or "we're working towards that." It has to be implemented once the deadlines arrive.
So Chris, walk me through the specifics. What are practices actually going to have to implement? There's
a few big ones, and some of them seem very obvious, but I know from experience there tend to be a lot of gaps. Things like encryption at rest and in transit become mandatory. So some of the older legacy systems that are out there that don't support that or don't have that implemented are going to have major overhauls. Network segmentation, a lot of smaller practices have very simple networks, and now it's going to be required that things like camera systems and servers and desktops and door controls are all on separate logical networks. There's going to be a requirement for network diagrams and documentation about how things are done, and administrative logs being retained for periods of time.
What about the monitoring side? How would that work?
There's going to be that requirement for auditability of administrative logs, security logs. They have to be retained for specific periods now. Penetration testing is going to be required. Vulnerability scanning and continuous review of vulnerabilities on the network and devices that connect to the network are going to be required and lead an audit trail.
It's a big jump from where a lot of small practices are today.
It really is. It's smaller practices, dental groups, optical groups, organizations that had simpler environments that were built years ago are going to have some real gaps that need to be closed as part of this to bring them into alignment.
So let's talk about what happens if something does go wrong. What's changing there?
There are two big things about speed that are coming up with this change. So if there's a loss of access to electronic patient information, it has to be restored within 72 hours or it's considered a violation that has to be reported.
From a reporting standpoint, what exactly does that mean in terms of breach notification?
That would be contacting the OCR, the Office of Civil Rights, and reporting that patient access to their data is unavailable and has been for longer than the allowed period, which is then going to trigger an investigation by the OCR.
It's a significant adjustment.
It's a very big adjustment. Another big change is that with security breaches, the old language was notifications without unreasonable delay, and now business associates that are aware of a security breach are going to need to be reporting that within 24 hours. There's a ripple effect there. With every business associate agreement that a practice has, with any vendor touching patient data, any references to that old 60-day notification language is going to have to be updated, with vendors needing to provide written attestation or third-party verification about their technical safeguards that are actually in place and that they will comply with that requirement to report within the required time period. So new business associate agreements with basically every vendor are going to have to be established.
So what actually triggered this? What pushed regulators to tighten things up this much?
A lot of this goes back to the Change Healthcare ransomware attack that happened a few years ago. That was a single incident in which around 100 million patient records were exposed. It rippled through pharmacy systems and insurance processing and just a huge portion of the healthcare data ecosystem.
Did they have a root cause? Were we able to determine the root cause of that?
As I understand it, the root cause of that was a single user account that didn't have multi-factor authentication enabled, and they were able to escalate from that one user's account and infiltrate, a massive network.
It's a sobering example of how one gap becomes a systematic problem.
It is, and it's a big part of why this rule is bringing HIPAA into line with other federal frameworks like NIST and CMMC, which are also already treating those controls as non-negotiables.
So for a practice owner watching this, what's one thing that they should do before this rule is finalized?
They should start now doing that gap analysis. The Office of Civil Rights has announced that they intend to publish the rule to the Federal Register in July of 27. There's going to be after that a 60-day window between publication and the rule going into effect. Once the rule goes into effect, covered entities will have 180 days to comply and an additional 60 days to make sure that all of their business associates are compliant with the new regulations.
So the practical first step really is an honest and true assessment of their environment and where they stand present day.
There's a lot of changes that are going to have to be made, and it's a year out from beginning right now, but there's so much change that a lot of practices are going to have to make that I think they need to start now with digging into that.
Chris, this is exactly the kind of thing practices should be getting ahead of rather than reacting to.
Exactly. Looking at things like, are there systems where MFA is not enforced? Are there legacy systems that don't have encryption? Assessing the need for log retention and, do they have systems in place for that, or do they need to get a SIEM solution, or, analyzing that cost of, okay, what's it going to take to become compliant, and start planning out, a timeline of how we can implement this so that we're not in a rush at the last minute when every medical organization is trying to also close their gaps.
If you're a practice owner and you're not sure where your organization stands against these changes, that's exactly the conversation we have with clients every day. Reach out to Vertilocity and let's walk through where your environment stands today.